I have a recurring nightmare. And it's not the monster under the bed or the monster in the closet. I wake up one morning and there's no community catalyst. That would be a problem.
The idea of community catalyst not being available as a resource, it's a day I don't want to think too much about.
When I think about a world without community catalyst, it sort of makes me want to cry.
I think it would not be an exaggeration to say the Louisiana Consumer Healthcare Coalition wouldn't exist.
We are trying to advance policy to leverage our own resources, so we need partners who are going to get that done.
Community Catalyst has a methodology that they call systems of advocacy, and it doesn't necessarily guarantee success, but without it, I think success is much less possible.
With Community Catalyst, you see an organization that has a deep knowledge and commitment to a set of issues, but also the ability to translate that knowledge and commitment to others.
Community Catalyst is giving voice to consumers across the country. Too often in the healthcare systems, the people who are the users of the systems are falling through the cracks. So we are organizing consumers across the country to really make change and make a healthcare system that's responsive to the needs of real people.
What made me want to start Community Catalyst was the Clinton administration was trying to move omnibus legislation for universal coverage. And it failed miserably, basically.
We saw there was something missing, that there weren't these kind of strong consumer organizations in every state. We thought that there should be.
And we always saw those things as inextricably linked, that you had to have that consumer voice be present in order to achieve quality, affordable health care for everybody.
Each state is different, has a different political environment. So we learned that there's no single cookie-cutter approach.
We've built up a wonderful and strong advocacy infrastructure.
It's translating between the folks on the ground who are doing the work in the field and what's going on the national level. So it's creating a feedback loop so that the national work is proceeding informed by what's happening on the ground, and the people on the ground know what's coming from the national front so they can react and actually get ahead of it.
With the support of Community Catalyst, we've been able to be more ambitious in our work.
The collaboration, the resources we've had, the technical support.
We don't really have the time and capacity to sort of like pull up out of the weeds and see what's happening in other parts of the country. They are constantly in conversation with states around the country, and so they bring what they know would be useful to us into those conversations as well.
The Community Catalyst Learning Community, it's a network of all our partner organizations that we work with across the country, putting our partners in touch with one another and getting them to share what's innovative, what's a challenge, how they've addressed these problems.
We say neighbors helping neighbors. What's working, what's not working, and there's an honesty that we share.
We don't have all the answers. The part of what we do is, together with advocates, think through new ways of listening and new solutions.
As a national funder, we don't have the capacity to have these close relationships with every state and every consumer group around the country, and that is a role that Community Catalyst plays.
Fast forward to our recent campaign to enact the Affordable Care Act. We were able to bring all that experience that had been developed now at the state level in the last 10 to 15 years and have it be critically present with legislators and with the administration around issues like the affordability of the premiums, the consumer voice in the implementation process.
So we were able to bring the voices of local advocates to Washington. People in Washington are hearing it from us, what they need to do to make the system work for people, but they're also hearing it, most importantly, from their constituents back home.
Community Catalyst has been a leader in organizing dozens of grassroots efforts around the country to create one powerful collective voice.
Traditionally, the special interest groups have really gotten their way.
We've taken on the pharmaceutical industry around conflict of interest.
Some nonprofit insurance plans and hospitals wanted to convert to for-profit status.
Advocates started saying, what happens to all those charitable assets that we helped them build by letting them not pay taxes? I think there was an expectation initially on the part of some of those interests that they could just take that charitable money and run. They couldn't, because people got organized, we gave them the tools to work with, and they stopped it.
We have a dental crisis. the access to dental care is very limited.
And we know that there are solutions to that, but organized dentistry has been a really strong opponent.
We're challenging them, saying that you have a responsibility as a profession to think about how everyone is going to be cared for, and if you can't do it yourselves, we'll find someone else to do it.
The whole organization is about making things happen. At the end of the day, you can be right and not succeed, or you can be mostly right and actually get something done. And I think they're very clear about the need to move the ball down the field and the fact that sometimes you can win by losing.
Keep your eye on the prize. You're not looking for the perfect in order to achieve something very, very concrete for groups of people who are really being disadvantaged.
Working with some of the people that we oppose and other things is a critical piece.
One of the things that Community Catalyst always reminds us is that even in our strongest foes, there's a relationship that's worth building on. When relationships are there, we can make things happen.
One of the challenges of doing this work is to work together, find the common ground.
We're able to compromise, and as a result, we see something like the Affordable Care Act, which, it's not perfect, but it's certainly a huge step forward.
The fantastic thing about working at Community Catalyst in general is you get to do great work that is meaningful, but you also get to do it with great people.
And when we are facing a lot of work and a lot of challenges, it makes coming to work every day really enjoyable, and I think we're just incredibly lucky to work with the people that we do.
With Community Catalyst, you have some of the most seasoned experts within the world of healthcare policy.
And these folks are known and are serious, and they make things happen.
My relationship with them has really developed into one of a lot of confidence, because when they tell me something is possible, I take their word for it. And when they tell me something is not, I believe them as well.
I also think Community Catalyst always has their eye on what's the next important set of issues for consumer advocates around the country.
And the things that we've accomplished, we haven't accomplished them because I'm so bright or we're so great. We've accomplished them because Community Catalyst have taken an interest to help make this thing happen.
I've always thought of Community Catalyst as really building the movement. It has a momentum of its own, has leadership of its own, and that's really what I'm most proud of.
There's always going to be a need for consumers to have a voice. The politics in this country, unfortunately, are biased towards the rich and the powerful. So Community Catalyst is out there representing the people who are falling through the cracks of the system, the people who don't have the resources. And I'm excited that there's a new generation growing up ready to take on all the fights.